you bring it down by everybody paying in their 3 to 4%, brings it up, and we end up with a solvent system and a trust fund that sets aside the money that would be needed to pay the cost, so that our hospitals and doctors would be operating on a budget that would be financed by the payments that are being made by individual workers and by the government paying the rest.
With the trust fund. Now, Radia, what do you think about taking insurance companies out of the equation and turning that portion of it over to the government? Do you think it has a chance to work? Do you think it'll make it worse? And I'm just thinking there's a lot of people that are very rich that are used to having very superior care, and now they're not going to necessarily get that. I mean, where does that affect that in the healthcare system?
Well, I think that there's just no choice at this point, considering the health of the system in the United States. There's no choice but to support H.R. 676 and taking the private insurance out of the equation. And actually, the bill has a provision for retraining these people, and because an administration is going to be needed to run the program, so it's not like all these people are going to be left on the street anyway.
So doesn't that grow government then?
Well, but I think that's not even the right question. It's not about the size of the government. At this point is, this system is failing its citizen. And that is just, not the mark of a democracy. So then you were talking about the, wealthy people. And under a system like that, they're still, able to pay for another level of care if they want to. They can, buy...
Wait, H.R. 676... You're able to pay, so if you do have, and it's still, so within our capitalistic system that we have, if you have that money, you can then say, I want better care.
Well, I think that what the bill says is that the private insurance companies cannot duplicate what's being offered. So there's room for providing more, and
so
above.
You can still have private insurance companies.
Yeah, but exactly. But I think this focuses more on providing, a basic level of care, at least ensuring that for,
for everybody.
For everybody. That's the goal here. Because right now, with the system that's in place, the private insurance companies have, this luxury of cherry picking who can, buy into their programs. So it basically burdens the poor people even more. So this is a very regressive way of delivering healthcare in the country, because the poorer you are, the more you pay. And actually, Johns Hopkins University did a study that documented that uninsured people pay 3 times more than people who have insurance, because when you have insurance, then the insurance company can have a bargain with the hospital. I mean, decrease prices or the cost of services or drugs, and that is not the case. So right now there's no pooling of the risk, and I think with the system that would be provided by H.R. 676, at least you would be better managing that. And it's okay to have this consideration for the wealthy people, but I mean, we're from a public health standpoint, because this is what I do. What I look at is, the big picture, and trying to, deliver care for the majority of people, not just for a small group.
Could I put in a word for rich people who may be concerned about this, the upper 1 or 2%? They have the same right to continue the same doctor that they have. Under our plan, everyone continues to choose his own doctor.
I mean, some of the concerns that I have heard is they're used to getting certain exams, like a mammogram, which that may not be available if we switch to another system, that they'd have to wait a couple of years.
Mammograms, whatever your doctor recommends, that's what you can get. So it isn't like... this isn't like going to a fruit market and deciding what fruit you want to buy. Whatever your healthcare needs are, whether you're a multimillionaire or a senior without any insurance, you will be able to go to the doctor of your choice. And so wealthy people will not have to change their doctor. their doctor will prescribe exactly what he's been prescribing before, and they will be able to get it, including drugs. Pharmaceutical drugs would be included in the plan so that we would get rid of this Part D plan that is costing people who fall into the so-called donut hole, are paying huge pharmacy bills. They can't. Some of them just can't even. They just forget about it.
Now, when the Part D was passed, and this was a way for anybody on Medicare would have a way to pay for their prescriptions. Mm-hmm. And the donut hole. Could you explain that just a little bit? What happened?
Well, after a certain period of time, these plans drop, and you are then at the mercy of the pharmacy companies changing the prices, and the prices always go up. They never go down. It's like subprime mortgages when they say adjustable rate.
That's another show we're going to be doing.
A very interesting issue that I'm working on. When they say it's adjustable, they mean adjustable upward. And so we realized that is not going to work. We won't have any Part Ds to worry about because everybody will get the health care treatments, the checkups, the preventive things that they need, the surgery,
Well, I mean, one of the most criticisms that I hear over and over is they cite that, like in Canada, you may be recommended for health care for an exam, but you have to wait and put on a waiting list for like a year. I mean, is there anything to those claims?
Well, I think that actually,
if there is, does HR 676 address those?
I did spend some time, trying to look at the complaints and I don't want do I want the government to pick my doctor? No way, and this is not what it's about. And actually, I just want to point out, with the current system, when you start your job, your employer has already decided, what plan you're going to have. So, and that, further down the line limits what doctor you're able to see, what drugs you're going to get. So there's already, reduced
we have
choice.
The HMOs, which
exactly.
have really grown.
No, but people don't realize that. We're talking about, the ability to choose, et cetera, et cetera. And with this bill, you have that choice. You can go to any doctor you want.
And now it's not just limited to a few on your HMO, but to actually anybody, to the same one that if you want to go to Beverly Hills and see a doctor that may be, somebody that may be a multimillionaire, you can go see that doctor too. I mean,
there's really no question about that. But to go back to your, the claim about, look at Canada, they have to wait months before they have the surgery. Well, one thing is, at least in other countries, they talk about...
They're talking about elective surgery.
They talk about their issues. I mean, everyone is scared and saying, are we going to have rationing in the United States? Are we going to have, to wait in line, etc.? Well, according to the Institute of Medicine, 18,000 Americans die every year because they don't have health insurance. So that's rationing right there for you. And with this bill, at least, we would get past that and not let someone die just because they don't have health insurance. But so here in the U.S.
Putting it that way, it almost sounds like a Scrooge, like, well, isn't there poorhouses, isn't there work?
No, but talking about the wait in Canada, if it's an emergency, they're not going to put you on a list for months until you need that surgery. So here, the difference with Canada is that in Canada, they have less money in the system. In the U.S., they have more money. They have, more medical equipment that they need.
In Canada, are the doctors paid by the government or by the health insurance fund?
No, doctors are not paid by the government in Canada.
So it's not too dissimilar from HR 676.
Yes, and our plan is written based on the Canadian experience, the British experience. I held hearings in Canada on the health insurance plan, and I met the doctors. I even met American citizens who came to my hearing. I remember the husband and wife, I think they were originally in Michigan, and they were told by their doctor, you should move, I recommend you move to Canada, because there's no way you can